Now, the impact of COVID-19 pandemic on all facets of life cannot be overemphasized. However, it seems that healthcare in Nigeria in the time of COVID-19 seems to be depreciating on several fronts. At the moment, all the focus on healthcare in Nigeria has gone to COVID-19, while other health needs of the population are being given less attention.
Very apt. Here in Lagos and other parts of Nigeria, several public and private hospitals have started to turn away patients because they do not have the facilities to carry out testing, and the risk to staff is high, coupled with the fact that hospitals want to avoid crowds of people in their facilities.
As a result of these difficulties faced by would-be patients at hospitals, most people now choose to self-medicate, buying drugs at pharmacies without adequate or no prescription at all. Well, joining us now to look at the impact of COVID-19 on the Nigerian healthcare system is Dr. Michael Ezeanochie, a women's health advocate, vice chairperson, Nigerian board, SOS Children's Village International, and consultant obstetrician and gynecologist at the University of Benin Teaching Hospital, Edo State. Thank you so much, Dr. Ezeanochie, for joining us this morning. Great to have you. Let me begin by asking you, because just yesterday we were told that 113 medical professionals and doctors in Nigeria have been infected by COVID-19, majority of them from private practice. How does that make you feel as a medical practitioner?
I think that COVID-19 is a serious health problem. It is new. We don't have a lot of experience managing it, and so we are going to have a lot of mistakes, and the impact is unpredictable. Healthcare workers in Nigeria are concerned. There's a lot of worry. The protocols for managing this condition is not so well known, and importantly, it is a condition that can spread while patients do not have symptoms. So being able to identify early somebody who has symptoms of this disease and institute protective measures isn't as easy as it is for normal infectious diseases that we know. So health workers all over the world, and not just in Nigeria, are vulnerable to COVID-19 infection, and it's an important part of the pandemic that we really need to look after because it's a big source for concern and worry.
All right. Prior to this time, we have always talked about the state of the healthcare sector in Nigeria. We cannot mitigate the effect of COVID-19 on this, but it looks as though it's staring at us in the face now. Those challenges we have constantly talked about. Only recently, they talked about the fact that we have 3,000 beds and the cases are ramping up. COVID-19 cases close to 2,000 now, so we're having already 1,000 beds just available, and that might lead to a shuffle if we have more cases. So the question now is, how can we provide more beds to the already stretched Nigerian healthcare system?
It's not a secret. Our healthcare system has challenges, and it wasn't in the best of shape before the outbreak of the COVID-19 pandemic. And even if you look at in the Western societies where you have more developed healthcare system, some of them have been overwhelmed and they ran out of infrastructure, personnel, and supplies. So that's another unique part of this pandemic, the ability to easily overrun even well-resourced health systems. I think before now, the NCDC and the government have tried an effective policy of isolating in facilities everybody who has tested positive for the COVID-19. But that has its own unique challenges because majority of these patients will not have symptoms or they will present with only mild disease. In hospital care in facilities in developed countries that have had high case burdens are usually reserved for those who present with severe or critical symptoms. Both approaches have their merits and demerits because if you can bring out everybody who's positive and place them in a facility, it's easy to quarantine or isolate the disease. But you run the risk of having your bed spaces fill up so easily, and then you may not have enough bed space for those who are coming in with severe or critical illness. So I think we are approaching the phase of the pandemic in Nigeria where the government, the NCDC, and the managing teams have to look for innovative ways to tackle the problem because we run the real risk of having our available bed capacities oversubscribed and putting our health system on strain. So I anticipate that going forward, we'll probably have a rethink of our current approach.
Speaking of innovative ways, rightfully said by Rufai here, we have about 3,500 beds as we speak, and the Director General of the NCDC did come out to say that possibility of a new strategy whereby people who have mild to little cases, infections rather, and have been properly said to be positive, COVID-19 positive, would now be treated from their homes, and NCDC officials would have to go and meet them in their homes for self-care. Now, how does that make you feel as a medical professional? And also, regarding the number of professionals that have been 113, like Adesuwa said, about 90% of those are private institutions. Now, people have, the Minister of Health has come out to say that people are actually still going to private hospitals to be treated for COVID-19, as opposed to coming into the NCDC facilities to make sure that they don't have this virus. So I want to know how you feel about those two notions this morning.
Yeah, it's a tricky one. In the absence of robust evidence, I wouldn't want to say that private health facilities are deliberately admitting and treating patients with COVID-19. Remember, this is an infection where an overwhelming majority of persons have no symptoms at all, or the early symptoms are things that could be associated with things like malaria. So somebody has a fever or a little bit of cough, and they go to a hospital. At the hospital, proper evaluation and assessment is done, and then if suspicion for COVID-19 is high, you now triage and bring in the NCDC. I think it may not be so easy or feasible to ask everybody who presents, who has a cough or a fever or malaise and feels weak to come to the isolation hospital. They'll be easily overwhelmed. An overwhelming majority of them probably have common things like malaria. People are still getting sick from bacterial infections and allergies and other causes of cough and catarrh and fever. So they will still continue to go to private hospitals. The concern should be, that's why I think the Nigerian Medical Association has tried to argue about this concept of who is a frontline health worker, restricting that definition to only those working in isolation facilities may not be feasible, because patients who present at hospitals with fever and cough, and some of them may have COVID-19, and therefore health workers who are working in these facilities will be exposed. So the question is, when we are providing PPE support to healthcare facilities, and they may need to take into consideration that some of these patients may enter the care system for COVID-19 to private healthcare facilities, and they should be appropriately supported.
Well, Dr. Ezeanochie, we would soon go on a break, but let me ask you the question so that when we return, you may commence to answer. Some states, beg your pardon, like Lagos State, have decided to opt for telemedicine to keep people away from the hospitals at a time like this, because we do know how COVID-19 can present without symptoms. I wonder how much of a pressure COVID-19 has put on the healthcare system in general, as regard other ailments and other diseases we are battling as a country. Secondly, I would also like to ask you on the Nigerian government's approach, which has gotten the attention of the WHO and the commendation as well. What is it that we are not doing, if at all? Let's go on that break, and we'll come back to get your reactions on these two questions. Telemedicine, some states are blazing the trail, such as Lagos State. Should we be looking at that option, or should we, find a way to keep people still go to the hospital, but prevent them from contracting COVID-19? We'll go on that break, and I'll be right back. Welcome back to the Morning Show here on the Rise News. We still have with us Dr. Michael Ezeanochie, a women's health advocate, vice chairperson, Nigerian board, SOS Children's Village International, and consultant obstetrician and gynecologist at the University of Benin Teaching Hospital, Edo State. Thank you so much, Doctor, for staying with us. For the benefit of our viewers who have just joined us during the break, let me re-ask those questions. My first question was the strain that the healthcare system is facing at a time like this, where you see 113 medical professionals infected, and that's because the hospitals have to remain open. what is the effect or what is the impact on treatment of other diseases at this time? And secondly, I was bringing to your attention the strategy of the Nigerian government and the healthcare workers in Nigeria that has got the commendation and recognition from the WHO. But I'm asking you as a medical professional, do you think there's something we're not doing at the moment that we should be doing?
Thank you. I'll start with the second question. I think their efforts by the Nigerian government is commendable. They've been doing intelligent testing and contact tracing to isolate persons, and they've agreed that their strategy should be dynamic and should change as the pandemic evolves. I think that we are globally, countries are struggling with availability of test kits, manpower to carry out massive testing, and even supply chain logistics to procure and to transport these commodities. So they will have to probably consider alternative approaches to support the good work they are doing and to improve the impact, especially in terms of numbers tested. Some persons have argued and advised that the model in South Africa, where the private sector is allowed to participate in testing, should be considered in Nigeria under the regulation and supervision of the NCDC and the federal government for quality assurance. There are a lot of persons in the country who would want to be tested, but they don't meet the NCDC algorithm for case definition, but they want to know. And corporations, companies, now that the economy is going into a partial reopening, if they can access private facilities and pay for this test for a reasonable fee and they are sure of the quality, I think that can also add to the quantum of the test. Actually, in South Africa, the private sector has tested more than the government in the pandemic. So I think it's one consideration that the NCDC should consider and also come in to regulate it so that the quality is assured. Looking at the impact in the hospitals, I think that it's been significant, especially in the private care sector that provides the majority of healthcare needs for Nigerians. We've seen big hospitals in Lagos shut down because of inadvertent exposure to patients who tested positive to the infectious disease and COVID-19. And the consequences have been shut down in services. Now, these shutdown in services have consequences because persons who usually patronize those hospitals for their healthcare needs may not feel comfortable to continue going there because of the fear of contracting the infection, which has been documented globally. A lot of the infections are nosocomial spread that is acquired from the hospitals. So they have genuine reasons to be wary. But should they fall sick, where do they go to? That's probably another area that the government needs to consider. I, as an obstetrician and gynecologist and a women's health advocate, is concerned especially for our pregnant women. We know that we have a high fertility rate. A lot of our women are pregnant. We are still encouraging the majority of them to come to hospitals. And then when you have this condition in hospitals that can put their health at risk, they have reasons to be worried. But even if they stop coming to hospitals, the pregnancy is still there. They require care. Where should they go to? Some persons have advocated that hospitals need to be innovative, embrace technology and telemedicine, internet-based consultations to provide remote support to these women rather than leaving them abandoned and feel vulnerable. So that when they have serious conditions, only at that moment should they present in hospitals. But I think that Nigeria's healthcare system before now has been fragile and we were having challenges. The attention that COVID-19 is getting is attracting a lot of resources away from maternal health, care for women, and neonatal health and child health, and care for vulnerable persons in conditions. And that puts them at risk of succumbing to their conditions. And these are the unseen consequences and effects of the COVID-19 pandemic on the Nigerian healthcare system.
Okay, Doctor.
And already straight system.
Doctor, I've just got two insights I want to put forward. I'm excited you talked about the pregnant women because I wanted to raise the issue, but you've done justice to that. But my first insight will be around herbal medicine. Because the president of Madagascar recently, got all the drugs, says it was tested in a couple of people, but the medical association and the scientists in Madagascar said they can't trust that drug. That's President Rajoelina. That's one. What should be, use of traditional or herbal options in this part of the world, owing to the fact that we have countries like China that most of their prescription and their documentation for medicine is traditional medicine to a large extent. Is there anything we can copy from countries like that? Secondly, do you think we're taking this seriously enough? I'm saying that on the heels of the response of a state governor to the lockdown already in the state, saying that the lockdown should be relaxed. And when you check across Africa, that's a pervasive trend. President Pierre Nkurunziza of Burundi, for instance, said, we don't believe in COVID-19 because God is taking care of our country. That's another refrain among some African leaders. So do you think we're taking it very seriously enough? And the fact about herbal medicine?
Thank you. COVID-19 is a new disease, and we don't have a standard orthodox medical cure for it. We're still learning it. And I think there's a lot of opportunities for innovation and accepting new ideas that are going to be beneficial. And so there's a room potentially for herbal medicine or alternative cure. However, orthodox medicine holds itself to rigorous standards that ensures safety for clients who have put a trust in us and what we advise them to do. So if there are herbal medicine preparations or alternative care preparations that can be beneficial in treating COVID-19, then they should bring it forward. And there's a department in the federal ministry that handles that. And then it should go through the same quality assurance processes, validation of the evidence and the claims to protect the general public, because it will be disastrous if we promote a herbal product that has not been validated and we shy away from using a more proven standard orthodox treatment, and the majority of the population start using things that turn out to become harmful. We owe them that moral duty to protect them, to ensure that whatever we recommend is safe and effective. As regards the political leadership across Africa taking the condition serious, I think they do. Nobody wants to die from a disease that you can't see when it's coming. And the majority of our leaders anyway are in the age bracket that are vulnerable to the pandemic. So obviously, I think that it's gotten enough attention. However, we should recall that Africa has its peculiar challenges. It's a continent where poverty is pervasive. It's a continent where basic healthcare indices are poor. It's a country where our literacy rate is poor. And it's a country, too, where we have large local occurrences of strife, displaced persons, conflict, and all that. So all these dynamics come into play in a response of the government to COVID-19. We may not be in the economic situation to enforce a total lockdown for a prolonged period. Otherwise, our people would die more from hunger, overcrowding, starvation, infection, and all that. So there's a need to strike a balance between our reality and our attempts to control the pandemic. And I think to a large extent, majority of them are doing it. But in Nigeria, one additional thing we need to see is increased ownership of the pandemic from the state governments. It is not too reassuring when you see state governments requesting for 50 or 100 test kits from NCDC. We need to see them from their budget, establish test centers in their states and own it, and work with the NCDC to ensure that what they are offering is of sufficient quality, and then they should get more regulatory support and professional support from the NCDC. We need our state governments to take more ownership of the pandemic for us to acquire or get the desired results.
Okay, let's talk about the NCDC bill that has been making the rounds on social media. I mean, it seeks to repeal the current Quarantine Act and enact the control of infectious diseases. Again, the NCDC Director General has come out to say that, this is not a time for us to be drafting bills. However, Honorable Femi Gbajamila believes that if this bill is passed, it will make the NCDC as well as the health sector a bit more proactive. What point of view do you go with?
I think there's a need for legal reforms as regards the control of infectious diseases in Nigeria, and that is absolute. However, in the middle of a crisis and a war, that may not be the best time to initiate such a venture, which is actually a long-term strategy or intervention to control infectious diseases. In addition, I think that the haste in which the attempt to pass the bill was made at the National Assembly gave a lot of people cause for concern. And of course, people became apprehensive and weary. So while the National Assembly is right to reform the bill, I think that to reform the law, I think that their approach has been a bit hasty. It's a serious thing that should be well thought out and should be painstakingly done to accommodate all interests and not rushed. So no, it should not be rushed. It's a longer-term strategy and not our immediate needs.
All right, Dr. Ezeanochie, in 40 seconds, if you can, what would be the first indication to you by the Nigerian government, and I'm saying governments as regards federal, state, and local governments, to show that we have learned lessons from COVID-19 as regards our health infrastructure?
For us, we need to see increased investments in the health of Nigerians. We need to see progression towards the targets of the Sustainable Development Goals to ensure every Nigerian has access to acceptable basic healthcare. So we need increased investments that is documented, that is clear, that we can all key into for every Nigerian, irrespective of religion, tribe, state, or social status.
All right, thank you so much for that. Fingers crossed. We're waiting to see that. Hopefully we'll get to see that soon.